I am Dr. Swannie Jett, and I have a passion for public health for over 30 years. Now, I'm in a position to affect change. And these are the critical conversations about health in our community with the people who can help me make those changes. Good morning. Welcome to CEO Live Talks. I'm your host, Dr. Swannie Jett, and today I have the pleasure to have with me my good friend, Ms. Whitney Austin. Welcome to the set.
Thanks for having me.
On this fine Saturday.
Yeah.
So, our last show, we talked a lot about Whitney's strong organization and the great things you're doing. Bring us up to date.
A lot.
Because I'm watching everything, so I know you have a lot going on.
Yeah, a lot has been going on. I feel a huge responsibility to get our message out there and to as many people as possible because we represent a different way of doing this work. Mm-hmm. When I say different way, I mean we want all people of political stripes to join in with us. We want gun owners and non-gun owners to join in with us. So we've had a lot of big opportunities in the last few months to get our message out there, one of which was the opportunity to go on Meet the Press Reports just a few weeks ago and be interviewed by Chuck Todd. In the month of September, it was a huge month for us because, believe it or not, it was the 5-year mark of my shooting. Mm-hmm. And so we spent a lot of time just loving and building up that community where this tragic event occurred through bringing education to the community, bringing researchers into the community to educate, and then also with our big A Night for Life gala. So for me, the last couple of months have been a lot about spreading the message, but we're about to turn into legislative season. And so that requires a little bit of a different hat for me to wear. A different
strategy.
Yes.
So I saw that it was the 5-year anniversary, and there was a few events in Cincinnati. By it being the 5-year anniversary, I mean, I know as years move out, reflect back a little bit on as time passes, how do you feel? Because each anniversary, I'm sure the first year was one thing, but ongoing, it's almost, to me, it's like you're losing a loved one. The years go by. It lessens the impact, but you still feel it.
Mm-hmm. Well, there's something about those big milestones that make people pay attention. And so 5 years was that for the city. And people were more engaged and willing to participate than they have been in the previous years. So the most special day for me, so we did 5 events in 5 days because of 5 years. And the most special event was on September 6th. And we brought several artists onto the square, Fountain Square, and we had them paint murals of victims of gun violence in the city. Now, not victims of September 6th, right. Other victims. A child who had been shot accidentally and killed, a child that was shot and killed at a party, a father who lost his life. And then, of course, there was the Genius of Water, which is the statue in the middle of Fountain Square kind of looking over them. But the point of that mural and of that event that day was to remind all of us that we are interconnected with this problem. It doesn't matter if it's the children we're losing or the adults that lost their life in a mass shooting. We are all interconnected by this violence, and we should all be on the side of trying to heal, but also to prevent it from happening in the future. And so it was unbelievably special to me that we could have that diverse group of people, the family members of those victims that were on the mural, my Fifth Third peers coming out of the tower and spending time with us, that we could all be together on that day. And that was the first time it had happened that way since the shooting. And it was just unbelievably meaningful. No one is okay. No one has moved on. Everyone is still in their own way trying to figure out how to move forward, but to just not feel alone. And that's what we created on that day. So I'll never forget it. It was extremely special.
Yeah, I wanted to make that day. I had some other events to go to. So I'm sorry I missed it. So, the one thing is to have the event, but what about you personally and your process of grieving through life?
For me, I've always felt like I won the lottery, that I survived something that I shouldn't have survived, that I got back home to my precious children, to my husband. And so I have always seen what happened through an entirely different lens than most people who lose a loved one, or they've experienced it and they're so broken as a result that they really have a hard time moving forward. It's the opposite for me. It's gratitude for the gift of life that I was given, but also a huge sense of responsibility to take that outcome that I am okay, and to push forward to try to make a difference for others that, haven't experienced it yet, but potentially will as the rates of gun violence increase, or for those that are just too broken to be able to advocate, because I truly believe that everyone that has gone through this experience wants to see change and wants to see people finding solutions, but some of them are just too broken or changed forever to have, the ability to be able to do that. So I feel like I carried that responsibility on my shoulders. And so it makes days like September 6th, not about me. It was not only that we were bringing in people from the bank that had experienced it and people from outside the bank, other incidents of gun violence, but I was able to spend time with some of the survivor family members from September 6th who I'd never met before, people who had flown in from other states. And so to be there to hold their hand and to help them walk the square for the first time, to see where the incident occurred, it's just my honor to be able to help those people. And so it was meaningful is the only word that I can use, and multifaceted in that there were so many layers of meaning for me on that day.
And we had an incident recently here in Louisville at National Park. Have you been able to reach out to those families or to people at the bank?
I certainly don't know everybody, but I've been able to connect with a few of the victims' family members, and it feels the same way, that I have a responsibility to be there to help them in whatever way I can. And if that just means to let them know they're not alone, then that's it. If it means to give them insight or pathway to join in advocacy, then that's it. But it's not about me, it's about them and whatever I can do to help them.
Hi, I'm Destiny. I'm the Community Health Workers Manager here at Park Duval Community Health Center. This is my team of community health workers.
Community health workers close care gaps, reduce barriers to care, and address health disparities in our community.
Community healthcare workers act as a bridge between the patient and the provider to stay engaged in the healthcare plan.
CHW strives to work as committed care team members for PDCHC, for current patients, and to provide access to those who need a new medical home. For more information, please visit pdchc.org or visit one of our centers. Thank you.
Hello, I'm Dr. Swannie Jett, CEO for Park Duval Community Health Centers. We conduct WIC, nutrition, and open enrollment for healthcare. So this is a one-stop shop facility for everybody in the community.
Hi, my name is Farron Jackson. This is Shakoya Gurton, and we're both medical assistants here at Park Duval Women's Health. We specialize in pregnant women, mammograms, ultrasound, and any vaginal complaint. So we offer free pregnancy tests. We offer glucose testing for our patients who are 27 weeks pregnant. We offer mammograms if they need one, if they find any lumps in their breast. And we also offer ultrasound if there's any abdominal pain or a pregnant patient. It's important for our women to keep up with their bodies because if they was to have a lump in their breast and they don't perform monthly, everyday breast check, it could be a lump there that may need a mammogram, and we could catch it just in case it's cancerous. You can contact us at pdchc.org, or you can call 502-774-4401, extension 1142.
Usually, weapons of mass destruction, I would call them. Me serving time in Iraq, I've always used M4, M16 first. So we talk about semi-automatic, we talk about 3-round bursts. And it's very quick. So when you go to automatic, you're just holding the trigger, right? Now, you can modify any weapon in today's world. But, we have a military. We have National Guard to protect us. There's not going to be a civil war anytime soon.
Hope not.
And there are bad actors. So all the bad actors don't have mental health issues. So let's be clear, right? Because we're passing laws as if everybody has a mental health issue.
Right.
So talk a little bit about that.
Yeah, no, you're right. That gets conflated, gun violence and mental health, as if only people with mental illness are the ones committing acts of violence. Mm-hmm. And that's really just not fair because most people with mental illness are nonviolent. But I do think it's also important to talk about how mental illness or mental health plays a role in some of these different forms of gun violence. So, for example, we know that the majority of gun deaths are attributed to suicide by firearm. And we also know that most people struggling with suicidal thoughts are also struggling with their mental health. So that does mean that most of the gun deaths are involved with our mental health in some way. But that's really different than saying, incidents of interpersonal violence are driven by mental health. Well, no, we know mostly that's something entirely different. And then when it comes to mass violence as just another form, then, and really this data varies, but I've seen, a third of perpetrators or 20% of perpetrators are motivated primarily by mental illness. So it's complicated, like so many other problems, but what we should all be on the side of is, being here to support people that are going through mental health struggles and being in a place to recognize that someone is struggling, recognize signs of suicide, and also being educated on what the mental health resources are in the community. Mm-hmm. Because mostly people need help, and mostly we can get people to a better place. But if you're educated on those things, I think you can do so much better for our country and for our safety.
Well, I'm going to explain it like this. Because I'm a researcher.
Okay.
Right? But I'm a very logical person. Right? Has anybody committed a mass shooting with an M40 or a Glock or a 9mm?
Yeah.
Have you seen it?
Yeah, my mass shooting was a 9mm.
9mm. How rare is that?
Oh, ask me something I know. I'm going to have to go back to the data and tell you how often it's a handgun versus a semi-automatic.
You very seldom see it. Let me tell you why. Because people that want to commit a mass shooting are looking at numbers. So it's always going to be something, a semi-automatic, right? Because it has 16 rounds and higher in the chamber, in the mag, right? Most of your suicides are not committed by semi-automatic.
Right.
It's committed by a handgun, right? A pistol, right? So that's the difference in when we push in legislation, we can work on suicides, right? Because that's what the military has worked effectively on. And so we need to look at those strategies and dealing with those couple mechanisms. But we're really trying to deal with mass shootings.
Yeah.
Right? Mass shootings and homicides. right? So in your mind, in your organization, what strategies are you using besides the two legislation? What is the biggest bang for the buck that we really should be looking for, in your opinion? I know you don't want to, your organization doesn't want to tackle it, but we really need a solution, evidence-based.
Yeah. Well, number one, I don't think there's one solution that's going to have major impact. I think it's going to need to be, 20 to 30 policies working in concert, along with community level change where we're all, working to make a difference within our neighborhoods. But if I could wave my magic wand.
I want utopia.
Well, there would be probably 20 plus policies that we would need to see. But if I could wave my magic wand and get something started that could potentially have a ripple effect, what I would like to see is a licensing and training requirement. So there's a lot of data that shows gun owners in particular are in support of policy changes that affect the who, not the what. So I'm a law-abiding citizen. I'm not causing any trouble. I should be able to have whatever firearm I want for whatever reason that I want. Leave me alone. But that guy over there, for whatever reason, he is not law-abiding and he should not have access. So let's limit him, but let's not limit the what. And so when it comes to licensing and training requirements, that's really about the who. And if you have the right protections in place up front, then you are going much further in your controls to make sure that really only law-abiding, responsible gun owners are those that have access to weapons. I think that limiting the what is certainly something to be discussed and has a role to play in this too. But I've not lately seen that there's a lot of data to support that those solutions can move. So I personally am a big fan of the licensing and the training requirements. When you think of the professionals in our environment that use firearms, from law enforcement to military, et cetera, there are a lot of requirements. No one is handed that firearm and said, go protect America, go protect our cities. No. I like you. I appreciate that you're giving, your life in some ways for this work, but I don't trust you yet. I need you to train. I need to show me that you're responsible with this firearm. So why? It doesn't make any sense that we do the opposite with civilians. You want to conceal carry, you want to open carry, come into my gun shop, here you go, walk out and do it the next day. It doesn't make any sense.
No, it doesn't.
And so that is the way that I would wave my wand, because I truly think that there are good guys with guns and people that make a difference in our society. But they didn't just turn out to be that way.
Right.
They trained and they worked hard to be that way.
We are here in the community. We partner with our community health workers to run vaccination clinics throughout the city of Louisville, specifically downtown and the West End. The importance of events like these is that a lot of people have transportation issues, so we are able to come out into the community and get people the vaccinations that they need.
So it's really important to have these type of events in the community because, as we know, when the COVID and flu season comes around, our underserved communities are hit the hardest. So if we can bring any vaccines or anything that they need, glucose testing, it's important to meet people where they're at.
At Park Duval, we care about the community. We do events like this monthly because we are the community and we love to give back to the community.
Be sure to visit our website for more of our upcoming community outreach events.
For more information, visit us online at pdchc.org.
Hello, my name is Sierra Clark and I'm the Chronic Disease Manager at Park Duval Community Health Center. Ever since I started at Park Duval over 9 years ago, I have been committed to helping patients live healthier lifestyles. I am currently serving patients in the Chronic Care Management Program, or CCM program. My team and I help patients manage their chronic conditions such as obesity, high blood pressure, high cholesterol, and diabetes. In this CCM program, you will receive several benefits to help you manage your health. We offer monthly telephone calls to check in with your progress and to assist you with any concerns, assistance with scheduling your healthcare appointments, and assistance with filling your prescriptions in a timely and convenient manner. We also offer many resources to help you with the barriers you may face with eating healthy, being physically active, or monitoring your conditions at home. For more information, visit us online at pdchc.org or visit one of our health centers.
Walk me through everything that Whitney Strong organization does, because a lot of people don't know, they should know.
Yeah.
And I want you to do that for the support as well, because you're a nonprofit, so
Yeah.
you have to raise funds.
So we have 2 areas of focus. We believe that we'll make change through legislation, and we also believe we'll make change through community with individual change, community level change, et cetera. So the legislative part I've already talked quite a bit about, and our marquee policy is crisis aversion and rights retention in Kentucky, although we're starting to do more advocacy work in other states like Ohio and Tennessee and Missouri. For the community level change, we believe that through education, we can really help people change their behaviors and start accelerating that change now. And so we're training people on safe storage, which we already talked about. And by the way, the technical definition of safe storage is that your gun is unloaded and locked in a separate location than your locked ammunition. It's like the double whammy. Make sure it's
So
really
you have
hard
to
to get
think.
to, right? We also educate people on firearm safety. So back to that training, what does safe handling look like? We also educate people on how to stop the bleed. So one of the things that helped save my life was applying 2 tourniquets to my left arm to control the bleeding until I could get to the emergency room. We also offer suicide prevention training for adults and for youth. And so when you think about all the different types of gun violence, we're just coming at it from all the angles. And right now, we offer this training in communities that are most impacted. So in the city of Louisville, those are all West End communities. In Cincinnati, they're more dispersed. But we are also about to launch our first rural pilot. So we know that homicide is happening disproportionately in cities, but suicide is happening disproportionately in rural areas. And so we're going to go into Gallia County, which is the county with the highest suicide rate in the state of Ohio, to bring them Stop the Bleed and also the suicide prevention training. So we really believe in this holistic approach that if you're in communities that are hardest hit and you're teaching them how to get more comfortable with these topics, how to change their behaviors, and you're showing them that you really care, you're giving them tourniquets, you're giving them access to or information so they know how to access their mental health resources, you're giving them gun locks, then they're going to be more willing in the long run to accept the policy solutions that you're advocating for at the state level and at the federal level. But to me, it all goes back to the core, and that is we care. We are in these communities because we care. We know deeply what gun violence can do to you, the trauma that comes from gun violence. So we're here to take all angles to make it better for your community. So that's really our holistic approach.
How many people have you touched?
So through our Save a Life program, which is the education program, we've trained over 1,800 people. But when it comes to the legislative work, we've seen more than 20,000 emails sent on our behalf at the state and then at the federal level. So tens of thousands of people at this point have engaged with Whitney Strong. But it's going to take hundreds of thousands of people to see the change that we want to see.
And how can the community be involved?
Lots of ways. So if your heart's pulling you toward education and making change at the local level, then I would encourage you to go to whitneystrong.org and sign up to be a volunteer, because we need trainers, we need volunteers to work with these communities. If the legislative angle is really pulling at your heart, same thing, sign up to be a volunteer, but now we're going to ask you to show up for hearings and to show up with friends to try to get more emails sent or more phone calls made. And then, of course, I always hold space for the people who I think most represent who I once was. big heart, cared a lot about a lot of things, but couldn't find the time. And so donations are always really helpful if you can't find the time to carve out for volunteer hours.
And how much funds do you need?
How much funds do I need?
What's your fundraising goal? Because you got, several programs going on.
Yeah, I'm hopeful that as we head into 2024, that it will be the year that we break the 1 million mark.
Okay.
So as an organization, we've been growing really steadily is probably not the right word because it's been somewhat aggressive over the last 5 years. But I think next year will be the year in which we turn the corner and we have a budget higher than $1 million. But really, that depends upon which project and as far as what dollars are needed. So I think to really make progress on the legislative front, I could use $1 million right now to make a difference on the legislative front because so much of that work is tied to the rural areas. And so in lieu of having a big team that can go to Pikeville or Northern Kentucky or Paducah, then you use technology, digital ads, for example. So I could easily spend $1 million alone on digital ads to get the message to the right people.
And, what is your last words that you want to tell the audience and how to support Whitney Strong and moving forward?
Yeah, so with Whitney Strong, we are rooted in hope. And that's really important because, number one, we've got death happening every day. And if you only pay attention to the headlines of how bad gun violence is, you may never be willing to write that email or make a phone call or show up in communities that need us. So we work really hard to put hope in front of people. And the most hopeful thing that I can share with you is that after 4 years of no hearing on our bill, we've got a hearing again.
Okay.
It's an interim hearing. It's happening Friday, December 15th at 10 a.m. Now it's in Frankfort, Kentucky. And I get it. I don't want to drive to Frankfort. You have to.
Right.
This is the first time in 4 years you have got to show your physical presence. I am here. I want to see change on this issue. And it came about because of our bipartisan team with Senator Westerfield out of Hopkinsville and Senator Yates out of Louisville. And it will be the best opportunity that anyone has seen in nearly 5 years to better understand what the legislature is on this issue, but to also have hope.
Right.
The Joint Judiciary is going to hear our bill. So I want everybody there. And I've got a Whitney Strong t-shirt for you. And you better believe that it will be meaningful for them when they see the crowd.
I'm going to make sure that, this is already going to be broadcast everywhere, but we're going to make sure we put it on our website. I'm going to send a contingency. And I look forward to this bill passing. So thank you. That concludes the show for today. I hope you enjoyed our conversation and see you again soon.